I'm ready.
Okay. Thanks so much for joining us this morning. This is Christy Bird McKeeve. I'm with the Butte-Glenn Medical Society, as are the two physicians who are joining this morning to talk about the COVID vaccine. We have Dr. Bill Whitlatch and Dr. Sean Liston, and we're very glad that they were able to join us. We're just going to start off with a discussion on points of view, what you're seeing, and feel free to jump in, either one of you.
Dr. Liston, would you like to start?
Sure. I got my second COVID vaccine on this past Monday, the Pfizer vaccine. The first vaccine, the only side effect I got was just a little bit of arm soreness. And then the second vaccine, as I had heard from colleagues of mine across the country who'd gotten the vaccine, the second vaccine had a little bit more of a reaction. So yesterday I had a little bit of a headache. I developed a little bit of a low-grade fever, got up to about 100.8. And then just felt fatigued. I didn't really have any muscle aches, but I just didn't feel great. But this morning, I'm fine. And it sure is probably a lot better than what I would have felt if I had gotten the actual.
Yeah. I similarly I've had both shots, and the second one I felt sort of like a mild flu for like 12 to 30 hours afterwards, but no fever. And now I feel fine. I got the second one last week, so it's really not a very big deal. So,
Right.
Are you hearing that that people are refusing the vaccine, at least anecdotally? Or?
Well, so I have kind of an interesting experience because I'm in private practice. So I have quite a few staff members that I'm kind of responsible for. And with my staff members, we'd gotten some idea that there was going to be some vaccine hesitancy with them getting the vaccine, because there's a lot of concerns about them feeling like this is new technology. And while it is newer technology, the technology has been around in terms of the mRNA vaccine for, going on actually a couple of decades. It's certainly been something that has been talked about and studied even before that. And so we had a discussion with my staff this last Friday to discuss the vaccine and sort of the history of vaccine, to try to educate them and to dispel some of the myths that are out there. So when I talked about the mRNA vaccine, I talked about the fact that it has been used before for, I believe it was the Zika virus. It was used for the SARS virus before, and that I described it as kind of a platform technology. So it's kind of like a drill. And then once you have a virus you want to target, you just simply reach into your case for the drill bit that fits with that virus. And so that's all this is. They've got the drill bit that they're putting on the mRNA platform to target this COVID-19 virus. Some additional concerns were that people were concerned that since it's got RNA in it, that therefore it's going to affect your DNA, which is not really how the cell biology works. The mRNA is just messenger RNA that just makes it so that it gets translated by these things called ribosomes to make proteins that have the spike protein. So that it's actually pretty fantastic that now we don't have to inject you with either live virus or attenuated virus or dead virus in order to mount an immune response. We don't have to inject you with the virus at all. We're simply injecting you with something that's going to make a protein that gets your body's immune system to react against it. And it turns out that protein is on the virus that we're targeting. So it's pretty amazing technology. It doesn't affect your DNA at all. The other concern was that, why is this virus not approved for the use in children? And actually, even beyond that, the questions we had gotten at that meeting, what is the data with regard to children? And we said, we don't know, because the Pfizer vaccine is only approved for people over the age of 16, and the Moderna vaccine is only approved for people over the age of 18. And one of the physicians that works in my office is a pediatric ophthalmologist, and she's involved in quite a few of the discussions with other pediatricians and pediatric specialists about how they determine the safety and efficacy of this vaccine in children and how we eventually get around to providing the vaccine to children. So it turns out that one of my staff members had said after our discussion that she, prior to it, had been vehemently opposed to getting the vaccine, but now, after the discussion we had, where we also pointed out that every single one of the physicians in my practice had gotten the vaccine and were first in line to try to get the vaccine, she now says that she's got some serious second thoughts about her vaccine hesitancy. So hopefully that, that's about as good as we can hope for, really.
Right, I agree with all those points. There's quite a few myths and a lot of fear about vaccines in general, but specifically this vaccine. I've seen anecdotally people will fixate on one anecdotal experience, like the example physician died from ITP in Florida. That's been posted over and over and over in a newspaper article. There's been no scientific evidence that's linked the COVID vaccine with low platelets, which is this form of disease, autoimmune disease that people get where their platelets are lower and they can die. But there's been many cases of COVID causing this disease, and a lot of people, unfortunately, are getting the vaccine and probably getting infected at COVID at the same time. So I think there's some confusion of the effects of COVID and the effects of the vaccine. But when we look at the actual trials in the New England Journal of Medicine, there's been no evidence of serious complications from at least the Moderna and the Pfizer one on my read. But in spite of that, people will see this one example of this physician dying 2 days after getting his vaccine, which probably too soon to even have this reaction to eliminate all your platelets from this one vaccine. And then there's just a lot of fear. And the second thing I hear is people want to say that I'm not anti-vaccine, but they want to wait and see what happens. And I find that disappointing because we know what's happening right now is lots of people are dying. And the longer people wait, I think the longer we will have more people getting ill, and the longer we will delay the restarting of the economy.
Yeah, those are some great points there. The thing I would also point out there, Bill, is even if that one physician had died from the vaccine, which is not really what is likely to be the case, the vaccine has been administered over 8 million times. And if you have one death out of 8 million doses of vaccine given, I guarantee you, if 8 million of those people had the coronavirus, it would be more than that we would be talking about.
Yeah, and if you go back to the original study, that the placebo group, the group that did not get the vaccine, had way more serious health issues than the vaccine group. So I think it's that simple. Any other issues or myths or problems that you've seen?
Well, one of the other points that was brought up in that meeting was one staff person brought up, they said, well, I'm a young, healthy person, and my question is, why should I get this vaccine? Because if you look at the mortality statistics for her age group, her risk of mortality is extremely low, which is true. And I said, you're absolutely right. So the vaccine, the likelihood of you dying from getting coronavirus is extremely low. However, there's a couple of points I wanted to make to her. I said, first of all, everybody focuses on the mortality rates. Very few people actually talk about the morbidity rate. And the morbidity rate is not insignificant. It's close to about 20%, where patients will get sick and then they have ongoing health concerns for months and months. We know that it affects the vasculature in the coronary muscle. It may increase the risk of stroke. It can cause long-term damage to your lungs, so you no longer have.
And not just the ability not to smell and taste is not a small thing. A lot of people complain to me, and there's one person in our office that unfortunately had corona and she still can't taste or smell. And that it may seem like a small thing, but that's a pretty difficult thing to live with, which may or may not last the rest of her life. So
That's true. The other thing that I wanted to point out to her was that I happen to know the staff person, and I happen to know that she is close to and her father has cancer and is over the age of 65. And I said, the idea of the vaccine isn't just to protect you, but it's also to help to
right.
try to protect others. The only
Yeah,
way to get
right.
to herd immunity is if we get a deep penetration of the population in terms of vaccination. There's going to be people out there where either the vaccine doesn't work because it's not 100% efficacious, or there's going to be people out there that can't get the vaccine because they have underlying health issues that prohibit it, or they're allergic to some of the vaccine. And so
Yeah.
I personally view it as one of my responsibilities as a physician and as a human being to not only try to protect my patients, but then to also try to protect the people in my life.
Yes. I mean, statistically, if 20 people get this vaccine, one will not be protected. And if the remaining if half the population is not getting vaccinated, then we will not slow this virus down. So yeah, that's a good point. I think there's several categories of people. There's some people that are very pro-vaccine. There's some people that are very anti-vaccine. And there's this large middle category of like indifferent, healthy young people. And because they're busy with their lives, and like that person, they say that, well, why should I get it? It doesn't affect me. I'm healthy. But they may actually be spreading it quite a bit, being the unknowing super spreaders. And so I think it may be interesting to, although we should vaccinate the first responders and the elderly, one of the groups that should be focused on vaccinating is these very active, healthy people who are still socializing, still going to the gym, and probably still spreading it to their grandparents unintentionally. So I've been trying to encourage these young, healthy people to get the vaccine, even though the data does not show that the vaccine prevents transmission. It probably does. It certainly reduces the symptoms in getting the disease. But as far as I understand it, I don't know if you can tell me what you think, Sean, that the vaccine has not been actually proven to prevent the transmission, so we still have to use precautions.
That's what I've been hearing as well. We don't know if it prevents you from transmitting the disease. It probably reduces it, but as of right now, at least until we get widespread penetration of the vaccine in the population, even though we're both fully vaccinated now, and in about a week I should be at that 95% efficacy in terms of protection, I still need to wear a mask. I still need to socially distance. I still need to try to minimize,
Right.
unnecessary activities out and about.
So someone asked me a good question. She said, if my father gets the vaccine and I get the vaccine and I wait 4 weeks, can I just go back to normal? And I think, I'm not sure quite what the answer. I don't think you can go back to normal, but you perhaps are able to visit close relatives, but still use precautions when you're out, and social distancing, I think, are the standard recommendations. So you can't really go back to normal, even if everyone has the vaccine. Also because the vaccine may not work, as you mentioned, will not work on everyone. So I think I don't think I have anything else to add other than I hope that people, I guess the next step would be, if someone decides what they want the vaccine, where do they go? If they're a layperson, if you're not at least in our community, if you're in the healthcare, it's relatively easy to sign up for it. Where do people go if they're not in healthcare and they want to sign up?
Well, there's a website that the California Department of Public Health is putting together. It's revamped, but it hasn't gone really effectively live yet. CalVax, CALVX, and you put in your name, you put in your location and how far you're willing to go, and I guess a date, and it can tell you what centers are within that area that are able to provide vaccination. It doesn't look like it's gone live yet, but I think that's going to be the website that's going to be put out there by the California Department of Public Health, so that the general population will be able to get vaccinated. I presume the reason that it hasn't been pushed out yet is because they didn't want to add to confusion, because right now the vaccination is not open to everybody. Right now, the vaccination is just open to the tiered groups, as we see. One of the things I would also point out is that now Enloe is sort of the vaccination center for our community. And so they're having people who are not affiliated with medical staff at Enloe, which is not an insignificant number of physicians in our community, as well as dentists in our community. They're opening up vaccination efforts to those non-affiliated care providers, as well as their staff. And so my staff, what they have to do is they either get letterhead stationery with their name saying they're an employee of my office and they're eligible to get the vaccines, or you can come in, I guess, with a pay stub. But there's a phone number for you to call at Enloe in order to get scheduled for your vaccine. And when you call in, they not only set up an appointment for that first vaccine, they automatically set up the appointment for the second booster vaccine.
Okay.
Yeah. I'm also hearing that a rural health clinic in Willows, so Glenn County area, is also preparing to be a vaccine center, not necessarily for the entire community, but we were able to donate some PPE to Dr. Joanne Reed to just ramp up and prepare for providing the vaccine. She's gone through the paperwork. It's just a note to providers in order to be a vaccine distributor. There's some paperwork, some steps that have to be taken in order to be authorized to do that. And if folks are interested, I guess start that process now so that we can all be prepared when the vaccines are available.
Well, do we have anything else to say? I mean, hopefully everyone will keep getting their vaccines as when they can. And hopefully we'll get back to normal in relatively soon. So whatever that is.
The fastest path to going back to normal is through the vaccine.
Which is, interesting. Historically, all major infections and outbreaks, that's what's had to happen. We've had to have a kind of a concerted effort to vaccinate to get things back to normal. Polio, smallpox. But I think this is the first time in at least American history that we've had such a strong anti-vaccine or even anti-science movement. And I think the best way to move forward is just to set by example rather than criticize people's fear, because I think their fears are legitimate, but we can address them. And some people, we're not going to change their minds, but the people that are on the fence or maybe indifferent, I think those are where we should target with the best and latest scientific information, and also realize that science by its nature is changing and things can change, that maybe something will come up and then we'll have to change our mind about the data, the use of the vaccine. But currently, the best strategy is to push forward and vaccinate.
Well said.
All right, well, thank you so much. I'm going to stop the recording now and post this later.